Hi everyone, I want to talk to you about Lyme disease. I would advise that you don't allow that tick to bite you. My advice, you may take it or not. Well, please take it. Why? Years later, you may be paying for that. Yes, let's go. Lyme disease was just discovered in 1982. It's a vector-borne disease transmitted by Aedes tick caused by bacteria by name Borrelia burgdorferi. This is very common in North America, United States, and Canada mostly. Azodes tick is friendly with small rodents like mice, and they use them as primary reservoir, while the hosts are deers. You can see all those highlighted stuff, the ticks, Borrelia burgdorferi, mice, deer, so that you know what to run away from while you're vacationing. Human beings are bugged by this tick, and that will happen at the time of enjoyment in summer, not in winter, mostly in wooded areas. How do we make diagnosis of Lyme disease? We use what we call enzyme-linked immunosorbent assay and Western blot. If it is early in infection, we use IgM immunoglobulin, and if it is after weeks, we go for IgG. How do we prevent this troublesome disease? Well, if you can, my best advice is don't visit the domain of the Aedes tick. And if you must, because your kids, your friends, family members want you there, okay, wear long sleeves and long and thick pants that the tick can penetrate. If others would choose not to, please do. Tick repellents on your skin, permethrin on your clothing. Physically look for, and if you're able to find, remove any tick after your arrival from their habitat. Don't forget to place. You can bathe. Even if you choose to bathe once in a week, make this a good assignment when you visit, wooded area in summer, bathe when you come back. Wash clothes in washing machine and dry with a very high heat. Why that? Someone will ask me why that. Okay, that is to kill any hidden tick or ticks. Pesticide spray on the habitat. If you have the money, as you're donating to charity, donate to buy pesticide and spray the habitat, preferably before you start vacationing there. In case you've been bitten and you could see the signs that you have been bitten by these ticks, what do? Run to your doctor. Not literally. Oh, okay, let me put it another way. Call your doctor. Oh, no, visit your doctor. Anyhow, get in touch so that you could be given doxycycline immediately you notice that you've been bitten. A road given by your doctor, not expecting you to get it over the counter, is an advice, not necessary. It won't happen. No doxycycline for anyone less than 8 years or any pregnant woman. No doxycycline. Do I need to tell you? Your doctor will know. What are the clinical features of this unwanted disease? That could be co-infection, that could be involvement of central nervous system, could affect your heart, and could affect the musculoskeletal system, your joints, your muscles. The first 2 weeks after you've been bitten, you will notice what we call erythema migrans. I'm not saying those that are immigrating or emigrating or they're going around, okay? Not the migrants. Erythema migrans. It's expanding. It's expanding. It's not going to be itchy, but there's going to be a kind of structure in the middle of it that's going to look like bull's eye. It will be red with the center will be clear and necrotic. Where are you going to find it? You're asking me? Okay, let me answer. Could be found in thigh, exposed areas, and when the tick would have gotten enough space to walk around, they go and hide in the hidden regions like axilla. Two months later, there's possibility of meningitis. Wow. CNS palsy, cranial nerve palsies, like cranial nerve 7, or we call it facial nerve palsy. You'll discover that there's one side of your face that is weak. Really, the mouth is not closing properly there. Or everyone who sees you will know something has gone wrong. Not that somebody punches you there, no. Peripheral neuritis. And if we do what we call lumbar puncture, stick a needle at your back, not to punish you, not to inflict pain on you, but just to pick a fluid there, because it was spinal fluid. Inside, it will be able to confirm the antibodies against that bacteria, Borrelia burgdorferi. It could be associated with headache, fatigue, paresthesia, or mild neck stiffness, because there is meningitis. Myocarditis or transient heart blockage could be first degree. If it is first degree, no problem. Maybe second degree or third degree. So some people have a condition called atrial fibrillation where the heart is beating fast. In this case, the heart is low, bradycardia. Many months later to years after you've vacationed in that region, you've gone back home, you're fine with your family, then you start having trouble because you didn't notice whether you've been bitten by the tick or not. There will be chronic arthritis in one joint. And sometimes if the tick and the bacteria both love you a lot, they allow you to have it in many joints. So acrodermatitis, chronicum, atropicans, neuropathy, pain everywhere, meningitis again, and encephalopathy. So it's just nothing like your heart, just nothing like your brain, and doesn't like your joints and muscles. Treatment. Or, doctor, are you going to watching me like this? What am I going to take for this? The early part of the infection, we can give efruxiferin, doxycycline, amoxicillin for 14 to 28 days. But if you have the brain already involved, that is neurological involvement. Then we give ceftriaxone intravenously with doxycycline for 14 to 28 days. If the heart is involved with either first degree heart block or second degree or third degree, we give ceftriaxone intravenously for 28 days. And we give doxycycline at the same time. Generally, we choose from ceftriaxone if you need intravenous antibiotics. But if you are going to choose anything per oral, amoxicillin, doxycycline, or ceftriaxone are fine. In conclusion, ask about prevalence of Lyme disease or ixodes tick before going to that resort on vacation. Oops. Do you think they're going to tell you the truth? I think they should be kind to tell you. And of course, they will also be planning to close down their business or relocate. Okay, just ask so that it could be justified later on if you are bitten by the tick and you come down with trouble. Have fun, but don't come back with tick. We don't want it. Okay, thank you. Thank you for listening to my presentation. Kindly subscribe to my channel so that you can be getting these presentations immediately they are published. Thank you. I appreciate it.